Improving Patient Satisfaction with Nursing Communication Using Bedside Report by Tia Baker, Amber Brown, and Stephanie Dolly, Southwest Baptist University. Table of Contents. Amber Brown did slides 1 through 9, 22, and the references. Stephanie Dolly did slides 10 through 15, 23, and the references. Tia Baker did slides 16 through 21, 24, references, and narrator. A brief overview of the article is the article describes the importance of maintaining a therapeutic relationship with the patient that includes involving the patient in bedside report. Kimberly Raddick conducted a study to determine if the standardizing shift report improved patient satisfaction with nursing communication. The conclusion was that there was a rise in patient satisfaction. Patient involvement in care is one of the 2011 National Patient Safety Goals, set by Joint Commission, and is mentioned in the Institute of Medicine Executive Summary, A Bridge to Quality. Bedside shift reporting will also have a positive impact on patient safety, as this will provide a means of decreasing miscommunication that can lead to healthcare errors. Brief overview of the theory is Hildegard Paplow defines the theory of interpersonal relationships and therapeutic relationships. The theory of interpersonal relations is based on a nurse-patient relationship and is crucial to a nurse assessing, planning, and intervening on the behalf of their patients. It is a theory that works with the patient, putting context behind the care that the nurse provides to the patient. A brief overview of Hildegard Paplow was, she was born in 1909 in Pennsylvania. She earned her bachelor's degree and then studied psychological issues at Chestnut Lodge, a psychiatric facility. This led to Paplow's life work, which extended Sullivan's interpersonal theory to be used in nursing. From 1943 to 1945, she served as an Army Corps nurse, working with leading figures in American and British psychiatry. In the early 1950s, she created and taught the first classes for graduate nursing students. She was a member of the faculty of College of Nursing at Rutgers University between 1954 and 1974, where she created the first graduate program for clinical specialties in psychiatric nursing. In the 1950s and 1960s, she offered summer workshops for nurses across the United States, where she taught interpersonal concepts and interviewing techniques, as well as individual, family, and group therapy. Some of Paplow's literature were Interpersonal Relations in Nursing, a Conceptual Frame of Reference for Psychodynamic Nursing, Interpersonal Theory in Nursing Practices, Selected Works of Hildegard E. Paplow, Basic Principles of Patient Counseling, extracts from 2 clinical nursing workshops in psychiatric hospitals, and On Cinematics, an article from Perspectives in Psychiatric Care. Some major concepts of this theory is Paplow's interpersonal relation theory defines the relationship between the nurse and the patient as one that is therapeutic and based on trust and mutual understanding, as well as open communication, and fosters mutual goal setting. Bedside Report is an initiative that can promote this type of relationship. 4 meta-paradigms go with this theory. Person, a developing organism that tries to reduce anxiety caused by needs. Health, a world symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. Nursing, a significant therapeutic interpersonal process that functions cooperatively with other human processes that make health possible for individuals in communities. Environment, existing forces outside the organism and in the context of the culture. The background of this theory is Paplow found that patient needed humane treatment, dignity, respect, and healing discussions. Paplow did not attempt to develop a theory, but wanted her voice heard on what she felt was needed to improve nursing practice, which was quality of nurse-patient interactions and nursing education. Some influence of this theory were Henry Stack Sullivan's Theory of Interpersonal Relations from 1953, Percival Symptoms, Abraham Maslow, and Neil Egler Miller. Some assumptions of the theory were nurses and patients can work together. Both the nurse and the patient can learn from a therapeutic relationship. Communication and interviewing skills are important, and nurses must understand themselves so their own values and beliefs are not projected on the patient. Phases of an interpersonal relationship are the following. Orientation. Problem is defined when the patient meets the nurse. Identification. The type of assistance needed is decided. Exploitation. Professional assistance for problem solving. Resolution. The patient needs are met and the professional relationship is terminated. Roles of a nurse. Papu also believed that the nurse could take on many other roles, including consultant, tutorer, safety agent, mediator, administrator, observer, and researcher. These were not defined in detail, but they were left to the intelligence and imagination of the readers. Other roles of a nurse could be stranger, teacher, resource person, counselor, surrogate, and leader. There are 4 levels of anxiety attached. First is mild anxiety, a positive state of heightened awareness and sharpened senses, allowing the person to learn new behaviors and solve problems. The person can take in all available stimuli. Secondly, moderate anxiety. It involves a decreased perceptual field, focuses on immediate tasks only. The person can learn new behavior or solve problems only with assistance. However, another person can redirect the person to the task. Thirdly, severe anxiety involves feelings of dread and terror. The person cannot be redirected to a task. He or she focuses only on scattered details and has psychological symptoms of tachycardia, diaphoresis, and chest pain. Fourthly, panic anxiety can involve loss of rational thought, delusions, hallucinations, and complete physical immobility and muteness. The person may bolt and run aimlessly, often exposing himself or herself to injury. How is this theory utilized in study? In the study, it is shown that patient satisfaction increases as a result of nurse communication, nurse to nurse, and nurse to patient, as a result of bedside reporting. This theory implements the importance of a therapeutic relationship in our patients and therefore sets the path for us to increase the communication with our patients through bedside reporting. Bedside reporting is a step to improve communication between nurses, patients, and their families in real time. It would assist with the provision of patient-focused care and the application of evidence-based practice at the bedside. How is this theory utilized in other practices? Paplou's theory is used in several different studies and practice areas, from the hospital to home health to web computer-driven healthcare. This theory of interpersonal relationships has been used and shown effective. Paplou's theory of interpersonal relations offers a framework for patient teaching that emphasizes the importance of a nurse-patient relationship. This therapeutic relationship enables the nurse to provide the patient with the information needed to understand the diagnosis, cooperate in the treatment plan, facilitate post-operative recovery, and return to the state of independence with quality of life. Paplou's theory fits the course of nurse-client relationship development as it naturally occurs in the home visiting setting. Paplou's interpersonal theory has long been utilized by mental health nurses in clinical practice. In particular, it emphasized the person rather than the problem to be focus of mental health nursing. This underlies that, according to Paplou, the therapeutic relationship is a central platform of mental health nursing practice. For the nurse application, Tia stated, "I work in a medical intensive care unit, and we get several post-cath lab patients. With this type of patient, you have to monitor them closely due to the fact that if they had stents placed in their heart, you do not want them to re-occlude, and after any type of heart-related procedure, the heart will be irritable. Patient teaching is key in this situation because the patient must let the nurse know if they are experiencing any type of chest pain, shortness of breath, or any of the original symptoms that brought them to the hospital, so the proper intervention can take place. Also, it is very important to teach these patients about antiplatelet therapy to prevent stent occlusion and how never to stop or skip taking their antiplatelet therapy once they are discharged to home. Developing a trustworthy and therapeutic relationship is key with every patient so they can have the best outcome. For Stephanie's application, she states, "At the hospital we teach about new ostomies. This theory applies as we include the patient. We show the patient how to care for their ostomy and progress towards them taking care of the ostomy. This is life-changing and incorporates many new fears and feelings. Listening to the concerns and leading the patient towards understanding and hopefully accepting their new lifestyle is an important aspect of my job. We follow the phases of an interpersonal relationship and many of the different roles of a nurse." Amber's application, she states, "As my experience as a nurse, I have devoted much of my time to the care of patients that are in the hospital following cardiac, vascular, and thoracic surgeries. In doing this, I have learned that no patient is the same. Our pathways for patients are the same following these surgeries, but the bedside report seems to really do the trick when it comes to 24-hour care of these patients. When teaching the nurse coming onto the shift about the care of the patients and the drains and the wires that may be in place, it gave me the chance to teach my patient about the critical goals in their care that will affect their health in the future and duration of stay in the hospital. It made the patients feel therapeutic in knowing that they had as much of a role in their care as much as the nurses."